All right, good morning. We're at 9:09. We've got 38 degrees here with Tony and Mike in the morning. Mike is off today, not feeling well. Hopefully he'll be back tomorrow, but we thank you for having a second cup of coffee here with us. Here in the studio is a nice lady, Dr. Michele Leonard. She is here from CT ENT, and we're going to talk a little bit about allergies and all of that. Doc, it's nice to have you here. How are you?
Well, thank you, Tony, for having me. I'm really great.
Yes, well, it's good. Yes, you are. You are really great. So glad you are here. Let's get right to it. Allergies. What type of allergies are you seeing this time of the year?
So right now we are in the spring tree season. Believe it or not, despite it being 38 degrees, there is a pollen count, and we've had a pollen count. Today it's a little low at 4.1, but we are seeing maple, elm, and juniper right now in the air, and people don't realize it because it's so cold, and the pollen count expected to be higher even tomorrow. So we have a lot of people already noticing the effects of
already. So what happens to these people when summer is in full swing? Spring and summer.
Yeah, so there'll be even more trees than these three, and then grass following. Right now, if people are just feeling fatigue and kind of out of it, their head gets a little cloudy. They don't feel so well. In a few more weeks, it's going to be the typical runny, itchy eyes and nose, clearing their throat, a foggy feeling in their throat.
Okay, and is it possible to never be affected by allergies, and one day you wake up and boom, there they are?
Yes, it is. People don't realize that. It's kind of like like a bucket. You can have a few of those allergies in your bucket. You don't notice it, and then one day it overflows, whether it's because you were outside, playing ball, mowing the lawn, or you just had the day off and were out shopping, or you're at the office and home, you open the windows, and the pollen just sort of hits you, and all of a sudden you feel it.
Okay, we're talking with Dr. Leonard. She's with CT ENT. Now, is this a good time to get an allergy test?
It is a good time. It's always a good time to get an allergy test. We do ENT allergy, which is ear, nose, and throat allergy, anything that affects the airway. And we do testing all year long.
And what does the test entail? What do you do?
You know what? It's very easy. We just do a little light pressure to the skin. We call it a skin test. And we test for 38 very common allergens: the trees, grasses, weeds, cat, dust, dog, and some common molds in the area. And we know in about an hour what you're allergic to.
Oh, really? That quickly?
Yeah.
Wow. Okay. And the allergies, like you said, trees and pets and things like that.
Yeah, anything in the air.
Yeah.
We do airway allergies.
Okay. All right. What does a typical allergy appointment at CT ENT consist of? What do you do?
Well, it's really fun. You first come in. We have a really great team. So you come in and you meet our team. We get your history, what's been bothering you. And then from there, we give you a really great ENT exam, which the patients love because we get to take a picture of your nose and throat. That doesn't happen in other offices, so they love that. And then you meet our wonderful allergy nurses, Maureen and Melissa, who will do the allergy test. We see you afterwards, and then we recommend. And then from there, it's fun because we customize your treatment.
Okay, all right. So whether it's pills or an inhaler or whatever?
So we do sublingual immunotherapy, which is a very fancy and scientific name for allergy drops. It's a drop under the tongue.
Okay.
And it's the same thing that's in an allergy shot, only it's mixed differently. So you can do a drop under the tongue, do it at home so you don't have to come into the office. And we customize it for your personal treatment plan.
Oh, okay.
So patients know what they're getting, and they like it, and they see the results, and it's fun because they get better. They don't need as much medication. They tolerate going outside, or if they're exposed to cats and dogs, they don't have symptoms. It's like you see the benefit.
So is the drops, I should say, is that taking the place of a shot?
Yes.
It is?
Yeah, it's immunotherapy.
Okay.
Which is another way of saying it teaches your body not to react to that tree pollen or that cat dander or that dog dander.
Okay.
It teaches your immune system not to get a stuffy nose when it's exposed to it.
Okay. You'd be surprised what's around the house. I mean, a few years ago, we put floors, pergo floors down, but the house was all rugged. And I took up all the rugs. And at the time, my father had a van. He said, take the van to take it to the dump. Put all the rugs, wrap them up, put them in there. and I couldn't go. It was too late. So I said, I'll leave it here, do it tomorrow. I got into that truck the next day. You'd be surprised how terrible it smelled.
Yes.
You know, you'd be surprised what is in that rug, you know? And of course we had a cat and all of that, but nonetheless, you don't realize it every day when you're living it.
Right, and when you're walking on that rug, all of that stuff gets into the air, the cat, the dog, the mold, the dust.
Sure.
So it's a very common scenario.
Yeah, absolutely. It's just amazing what happens to be around the house. Can you really get in and out of the office within 90 minutes?
You can. The picture I described before, the little vignette you do, you come in, meet the staff. The pictures of your nose and throat are very quick. We ask you some questions, and then you meet the staff, get the skin test, and it's very easy.
Okay, the allergy drops. That's a great thing. That really is, because how many people come in there and they start crying or faint when you pull out the needle?
Right. Who wants a shot?
That's for sure.
It's an extract, so it's great.
Okay, Dr. Leonard, unfortunately, we have run out of time, but if people want to get in touch with you, if they want to make an appointment, is there a website? What do they do?
ctent.com.
Okay.
Or you can just call the office direct, 203-845-2244.
And where are you located?
We are at 761 Main Avenue in Norwalk, which is iPark, a large medical building right across the street from Walmart and LA Fitness.
Okay, know exactly where
Very
you are.
easy to find.
Yes, absolutely. I thank you so much for taking a few minutes.
Thank you.
All right, we'll talk to you soon.